Today we are covering surgical asepsis and sterile technique, a critical concept the NCLEX will absolutely test you on, often through priority and delegation questions. The single most important rule to remember for the exam is that sterility is absolute. There is no such thing as mostly sterile or probably still clean. An object or field is either 100% sterile or it is 100% contaminated. The exam will present scenarios to see if you fall for a gray area, but you must remain firm in this black and white thinking. Let's consider a classic exam-style question. A nurse is preparing a sterile field to insert a urinary catheter. After setting up the drape and placing sterile supplies on it, the nurse's sleeve briefly brushes against the outer 1-inch border of the sterile field. What is the nurse's priority action? The correct answer is always to stop and replace the entire field and supplies. The exam might offer tempting distractors like continue with the procedure since it was only the border, or replace only the items near the border. These are incorrect because the integrity of the entire field is now compromised. That 1-inch border is your buffer zone and is always considered contaminated. Another common trap involves a nurse turning their back on the sterile field. Imagine a surgeon asks you for an additional instrument. You turn away from your sterile Mayo stand for a moment to retrieve it. For the NCLEX, that field is now contaminated. The principle is that a sterile field must always remain in your line of sight. Similarly, any sterile item held below your waist or table level is considered contaminated. You'll see questions where a nurse lowers their gloved hands to their side. This is a break in technique, and the correct action would be to perform hand hygiene and don new sterile gloves. Moisture is another key vector for contamination that the exam loves to test. If a sterile drape becomes wet, it creates a wicking action, pulling microbes from the non-sterile surface underneath up to the sterile surface. A scenario might describe a nurse spilling a small amount of sterile saline on the drape. Even though the solution is sterile, the wet field is now contaminated. Your immediate action is to dispose of that field and start over. To help remember these core principles under exam pressure, use the mnemonic STERILE. S stands for sight. Always keep the field in your sight. T is for table, meaning keep sterile items above waist or table level. E is for edges. The 1-inch border is contaminated. R reminds you not to reach over a sterile field, as this can cause microbes to fall from your arm or clothing. E stands for items. Only sterile items can touch other sterile items. L is for liquids, which can cause strike-through contamination if the field becomes wet. And finally, E is for exposure, as prolonged exposure to air can compromise sterility. Be prepared to differentiate surgical asepsis from medical asepsis or clean technique. Inserting a Foley catheter, changing a central line dressing, or performing tracheostomy care requires surgical asepsis. In contrast, inserting a nasogastric tube or administering a routine injection uses medical asepsis. The exam will test your judgment on which technique is appropriate for a given situation. Ultimately, your guiding principle must always be patient safety. When in doubt on the NCLEX, always choose the option that most strictly adheres to the principles of sterility.